When I was about 9 years old, I had a fantastic family doctor. He just was the most kind, giving type of doctor, and I loved it when I went to see him and he put the stethoscope on me and listened to my heart and listened to my lungs, and loved it. All the little tools looking in my mouth and ears, and I said, wow, I really enjoy this concept of medicine. And then about a year later, I asked my parents to get me an anatomy book. It's actually called Gray's Anatomy. I mean, there's a show on TV now called Gray's Anatomy, but it really is based on a true textbook. I thought by age 10 or 11 I was going to go into medicine. As time went on, I actually got very interested in the brain and the spinal cord. And a lot of the textbooks that I was reading were about the brain, the function of the brain, the anatomy of the brain. It fascinated me. And when I went to college, I chose a college. I went to Colgate University, upstate New York, where they had an actual neurosciences degree. So you could major in something called neurosciences. And it was usually a combined biology, psychology major. And it was perfect for me. And frankly, graduating college, I was going to go right into neurology, medical neurology. And then when I got to medical school, I realized I was more the surgical type. Like to get my hands, doing things, and I'm a pianist. I like playing the piano. I like creating things. So it was more my style to use my hands and to actually do surgery. And neurosurgery was a natural for me, using the knowledge of neurology to do surgical intervention. I wound up going to Georgetown University for my residency, which was my first choice, and apparently I was their first choice also, which was great because that's the way the match works. And I spent 7 years of neurosurgical training there, general neurosurgery. But then I became interested in mostly brain work. I do very little spine work right now. I trained on a special machine called the Gamma knife. Gamma knife was being invented, or it wasn't being invented, but it was being implemented in the United States in the late 80s. And I was fortunate to get a fellowship with one of the best people in the world, Dade Lunsford, who was in Pittsburgh. In 1990, I did a one-year fellowship out there in Pittsburgh, Pennsylvania, on the Gamma knife. So I learned my brain tumor work, my functional neurosurgery work with things like Parkinson's disease, etc., and my knowledge of radiosurgery, which is the Gamma knife, all through Dade Lunsford, really, up in Pittsburgh. In 1993, I moved out here and took a position at Good Samaritan Hospital in Los Angeles, downtown, and then Hoag Hospital recruited me in 1997. I would say 3 crowning achievements that I would feel very proud of talking about, of what I've done in my career. The first is I'm one of the world's experts in using the Gamma knife. Since I was around when it was started in America, I've done more than 8,000 patients on the Gamma knife for various conditions, whether it be for brain tumors, for metastases from lung cancer or breast cancer, or for conditions like trigeminal neuralgia. The Gamma knife is used for that in lieu of open brain surgery. So you don't have to open up a patient's head to do the surgery on a brain tumor, for example. So it was very innovative work way back then, in the early 90s. Second achievement that I'm very proud of is my specialized treatment of the worst brain tumor that exists, which is called glioblastoma. And this is the type of tumor that is basically, it's one of the most common brain tumors, and it has no known cure yet. It is a cancer. We've seen it in the press. We've seen it. John McCain has it right now, Senator McCain. Ted Kennedy died of it, and Joe Biden's son, died of it just recently as well. So it's been in the media recently, and these are people high in society that can get any treatment they want, and they're still dying of this disease. So we got a real problem here. But 2 years ago, I patented a technique for treating this. I have a United States patent on my specialized treatment. It's called leading edge radiosurgery, where I use the gamma knife actually to treat the tumor as it's migrating through the brain. This tumor is special because it doesn't grow like a snowball getting larger and larger. It grows by infiltrating in the brain. Each little tumor cell migrates through the brain. So I said, why don't we catch it as it's migrating so it can't get any farther into the brain? And it turns out that these tumor cells, if they can't migrate, they self-destruct. So if you can actually stop them from making it through the brain where they want to go, you can possibly kill the tumor completely. And I have 10-year survivors with glioblastoma. I have many patients who are out more than 5 years with glioblastoma. Many, more than 20. So I'm the first person in the country, let alone the world, who is implanting stem cells directly into the hollow cavities of the brain called the ventricles for conditions like Alzheimer's disease, multiple sclerosis, ALS, Parkinson's disease, advanced Parkinson's disease, etc. A lot of the diseases I treat don't have a cure, but I get my gratification if I can keep them alive longer. I also tell patients, if we can keep you alive 3 years, where you were normally going to die in a year, what's going to be available 3 years from now? Maybe something miraculous. We may have a cure or a new drug by that time. So keeping patients alive longer and longer with better quality of life is one of my major goals. Well, as far as my personal achievements, I hope I have many of those as well. I would say one of them is a very successful family life. I have 3 beautiful children and a wonderful wife. We're going on our 20th anniversary coming up. And my kids are just spectacular. They're good kids. My 18-year-old's off to college. So hopefully I've helped raise them well. One of my absolutely important caveats was that I tried to get home for dinner every night to be with my family. You know, in the medical profession, we have great difficulty doing that because we're caring for patients, we have emergencies, but absolutely every night I try to get home between 6 and 6:30 to have dinner at the table with the family, and I think that's a very important aspect of raising children. They always humble you. You're always humbled by your family, you know. I'm a brain surgeon here and I'm revered very highly in the hospital. I come home, I'm just dad. And so, you know, no one worships me at home in that way. And so the family unit is what brings you down to reality and what really is important. I'm an avid musician. Okay, I mentioned that earlier. I took piano lessons starting when I was a kid, and that was from my request. I chose to do the piano lessons. My parents didn't force me. And to this day, I still play music, and I'm in a rock band today, and we just play for fun. If I had to summarize my life's work in a single word, it would be motivation. I'm just motivated incessantly to do something. If I see something being done and I feel I could do it better, there's a motivation for me to change that. If there's a disease in the brain that we haven't beaten yet, I feel motivated to do something about it. That's kind of the way I am. If there's a song on a piano that I want to play, I have to be motivated to do it. I also have a 501c3 charity, which is based on using music to heal people. It's called the Music Heals Project, and it's got, well, if you look it up, it's music-heals. Don't forget the dash. Heals, as in healing. So we are working on ways that music can help people medically. For example, our most recent approach is for autism. A lot of autistic children are really helped by listening or playing music, listening to or playing music. And what is it about that music that turns them on? Well, we're working with a group in Nashville, Tennessee, Vanderbilt University, and they came up with this idea that autistic children, their brain waves, their EEGs are out of sync. And it's my idea, and a few others, that maybe music resynchronizes the brain waves for these kids and makes them better. So you could use music as a therapy for these children instead of, say, medication. Maybe they should listen to a beat or a rhythm 3 times a day, like they would take a pill 3 times a day. And maybe that resynchronizes their brain waves. This is the work we're starting to work on right now. My legacy, hopefully, is some of my stem cell work that is just beginning. My legacy is my work on glioblastoma, which is about halfway into its beginning. And in general, what I've brought to the field of radiosurgery with a gamma knife and my work with Parkinson's disease. So all of those could be considered something I'd be very proud to be my legacy. In the field of medicine, what I would pass on to the future generations is really simple. You go into the field of medicine because you want to. You do it because you want to help people. And you don't do it for other methods, for means like money or fame or fortune. If you do it for the pure sole purpose of helping every person, then everything's great. I'd like to be remembered for my accomplishments in the field of brain surgery. I can't wait. I hope that I'll be remembered for my accomplishments in stem cell work. I hope that I am remembered, by my family as a great dad and by my wife as a great husband. So, and from my band members as a good musician. We'll see. But that would be all very good.